British Sikh doctors have raised concerns after a number of them were kept away from frontline NHS roles because they were unable to wear the appropriate protective equipment due to their beards. Allowing body hair to grow is a religious requirement for Sikhs, so the advice that healthcare workers should shave off beards in order to gain greater protection from face masks presents many Sikhs on the front line with a dilemma to choose between their medical vocation and their personal faith. Dr Sukhpal Gill is president of the UK's Sikh Doctors and Dentists Association.
These masks require a very tight fit against the skin so that no airborne particles or pathogens can enter via any gaps in that mask. What we've sort of had in the NHS is sort of guidance to say, look, these kind of beards are not allowed or these kind of beards are allowed. And you have to pass the fit test for that mask to be able to use it safely. Some of our colleagues who sort of support unshorn beards, so these are sort of practicing Sikh doctors, have unfortunately failed that fit test because of the beard, and they haven't been able to achieve that tight seal. So they've been given the option to either shave the beard and have the right kit for their own personal safety, or be moved to alternate setting, which is a relatively lower setting where we don't have the aerosol generating procedures.
Is there an alternative mask that actually would do the job, technically?
There is. One that's sort of commonly sort of known about is called a powered air purifying respirator. You might have seen it in the movies, that they sort of don it like a hood, and you have a sort of a battery-powered sort of pack that allows sort of purified air to go into the device and then stale air to be removed. It is a great expense, and this is where sort of perhaps, some of the issue has been with some of the NHS trusts. They have to sort of balance the cost economies with cost effectiveness with, where they deploy their staff. Now, so of the 5 doctors that we had sort of approach us via the Sikh Doctors Organisation, fortunately, they've all been sort of supported quite well with their NHS trusts. For instance, there's a colleague who works in cardiothoracics. He has been given one of these expensive devices. And I suppose that's balancing his level of expertise and skill against sort of that cost, really.
Given all of this, what we've been talking about, these safety concerns and the dilemmas, but also the death last month of the Sikh A&E consultant Manjit Singh Riyad, how are Sikh doctors feeling at the moment, just in terms of their own personal safety, while you fight for the rest of us on the front line?
It's a very important question you raise there. So Dr. Manjit Singh Riyad, a fairly sort of popular personality and a pillar of the Sikh community. Very honestly, we are feeling concerned that along with sort of the recent data from the ONS that's come out with BAME communities are disproportionately affected in this crisis. There is a sort of fair bit of concern amongst our colleagues about how they can optimise their own protection.
And I can imagine that there will be, heightened levels of anxiety amongst your colleagues because they don't want to be placed in that difficult dilemma. What about the relationships with other colleagues in the healthcare service at the front line? Have there been any tensions created because of these issues?
Well, this is it. So the feedback we're getting is there's sort of a lack of understanding amongst some other non-Sikh colleagues. So, maybe sort of in the passing, they've had sort of phrases like, come on, brave the shave, or come on, surely God would understand if you wanted to protect your life by shaving your beard. And that sort of thing obviously doesn't help the Sikh faith followers who are actually not wanting to shy away from the duties on the front line. They simply want the right type of protection. So they, that just like me and you, they can see through and come out the other end of this COVID crisis.
Yeah. Have you managed to resolve these issues now with the NHS trusts?
Yes, so fortunately, all the NHS trusts that have been sort of involved, they've been very understanding. So with a bit of dialogue, the sort of relevant doctors have either been provided the right type of respiratory protective equipment or being deployed elsewhere until it can be sourced.
Dr Sukhpal Gill.